Welcome to At Homes Total Home Healthcare Solution, a Dr. Bose's SAANS Foundation initiative, where the care is tactile with a smile. Current scenario says the elderly Indian population is one of the fastest growing in the world. At 110 million, India has a second largest global population of aging citizens, and the fastest growing segment of the population is 85 and older age group. The situation is very alarming. They need assistance, they need care, they need empathy. The challenges with the old age are too many. What we need to create certain prevention in their physical disability and give them an extension of active life expectancy, and the most important, they need a positive attitude, because this is an age group. They feel lonely, they feel depressed, they're little left out, so they lose their mental wellness. So we need to help them to create a positive attitude. And recent study says that healthy aging is achievable with a sound planning of age, because most of these elderly people, they lose their muscle functions because of deconditioning, certain chronic diseases like diabetes, cardiorespiratory, and to a certain extent certain dementia. They can be prevented with a good planning and a good rehabilitation and approach. And what we need to work harder is from changing from the concept of aging, which is adding years to life, to growing. That means we have to add life to their years. So these are the challenges, and if we work positively with them, the situation can be reversed to a certain extent and their quality of life can be improved. Now, what is the need of the hour? Need of the hour is we need to create interactive health talks and awareness programs, because they need a dialogue. We need to talk to them one-to-one in small groups, and proper integrated continuity in healthcare which is required, that is in home care, because most of these people, they are going to the hospitals. Frequently it's something like a revolving door practice, but nobody is talking about the continuity in care, because most of the diseases are chronic diseases. With good planning, with good support services, with good guidance, they can have a good chronic care program. And we need for them good paramedics, because the doctors and the nurses are not available for them. So we need to have proper training programs with the health workers who have an aptitude in geriatric care. And we need also certain wellness coach and rehabilitation experts. India has a huge population of therapists and psychologists. We need to train them, and their trained people are available who can play a very active role in the old age care. And moreover, we have to rehabilitate them from vocational point of view, because most of these elderly people, they need some vocations, and so that they can play a very active role in the society. And if you see what exactly Dr. Bose's SAANS Foundation is doing on the left side, for the last 2 decades, Dr. Bose has been working very hard to create awareness at the different grassroots levels. He has been active in community outreach initiatives, doing free checkups for the elderly people, in the print medium, creating an awareness with different initiatives through his Breathers Club, because he's being a breathing expert. He's been working a lot of different areas with different cohorts, different NGOs at different resident welfare associations to create an awareness about good health. His newsletter, the SAANS, is a public awareness newsletter which is playing a very important role to create awareness and creating a dialogue with the society. And over the last few years, he has been contributing significantly in writing books, creating awareness, workshops, seminars. And since his expertise is in breathing and sleep has been a very important component of old age care, so he has been working very cohesively with different organizations, with other active professionals, to create an awareness and working in continuity in home care, what is called the home care. On the right side, we are showing that this mobility van, which is a home care van, he has been training the paramedics, the healthcare workers who have an aptitude in health sector, and more than 1,000 healthcare had been trained. They are working at different home care levels, and these people have been trained on the level of attitude, skill and knowledge. And Dr. Bose feels that unless and until you bring an attitudinal change at the home care level, there's no point in skilling them. So they need the right attitude, the right compassion, the right kind of techniques to motivate these elderly people with of course with the right knowledge and skill. This is what we call an ask. So this capacity building, what you call the SAKSHAM, which is nurturing concern and talent, basically working for the elderly people. The SAKSHAM is an academy, is recognized by the Health Sector Skill Council, and Dr. Bose said the SAANS Foundation is also recognized by Director General of Health Services for his specialty work. And he has been also involved in different breathing techniques. The Vitaka Clinic, which is an international forum in training breathing solutions to the people using this technique at a home care to take care of different situations. At the right bottom below, we are showing that the therapists are educating the elderly people at home, giving them the rehabilitation program. They are working 360 degrees. They are talking at the level of cognition level, the support level, the nutrition level, and different endurance levels. So overall, this paramedics and rehabilitation, and of course with the support team playing a tremendous amount of role in home care delivery system, and this is very unique and different from other home care delivery system. So the whole philosophy of SAANS At Home solution is that they treat the disease as a whole, WHOLE. That means you treat the disease holistically, not simply as a whole in the body. It's not something like HOLE. So what it has been practiced in SAANS is that if you really want to bring a change, you have to change the mindset of the disease, what you call the illness. So it's a journey from illness to wellness, where the patients are subjected to a physical wellness, mental wellness, emotional wellness, environmental, social to spiritual wellness. And all these wellness programs are structured. They are handled by the paramedics and the wellness coach and the therapist. And it's a very unique program. And when this kind of program is adopted at home care solutions, the patients we have seen over the years, they become very functional, they become very motivated, and definitely what we call the reversal of chronic disease becomes possible. The whole value in the SAANS Foundation is that empathy, not sympathy, because empathy is the most important thing. Unless and until you empathize with this section of the population, you cannot bring a tangible change in the society. At home care program has structured program in chronic care, geriatric care, palliative care, rehabilitation care, post-surgical and long-term care. There are structured programs. We'll be talking separately about this program, but this is one page. You can click a photograph, you can send to your near and dear friends. All these facilities are available. We can help with your post-discharge care at home. You can call 8384019016. I'll repeat, 8384019016 or 98101-59687, which is the Dr. Bose's direct number. You can text him or call him about all the services. They have a team for sample collection, physiotherapy, nursing, critical care at home, medicine delivery. Even the people who are needy, they are providing subsidized medicines, medical equipments, doctor visit, and of course the patient assistance. So dear friends, avail these services. SAANS At Home home care solution is a very innovative way of reaching to the patients, taking care of them. This 360-degree program is very innovative, and for any kind of support, please call us and visit our website www.saansfoundationindia.com. I'll repeat, www.saansfoundationindia.com, and you can directly mail Dr. Bose, ppbose.saans@gmail.com. I'll repeat, ppbose.saans@gmail.com, and his personal mobile number is 98101-59687. I'll repeat, 98101-59687. Thank you so much.